Welcome to Pennsylvania Newsmakers. My name is Gene Barr. I'm your host for this week's program. Well, today we're going to talk a little bit about how small business is doing in Pennsylvania. Then we're going to talk about your access to health care in the Commonwealth, and all that starts after these messages.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host.
Welcome back to Pennsylvania Newsmakers. My first guest here today is Greg Moreland. Greg is the State Director for the National Federation of Independent Business. Greg, thanks for joining us today.
Thanks for having me, Gene.
Absolutely. So you've been in your position now for how long?
About 4 years. About
4 years. Okay.
Yep.
And you've also worked over in the Capitol area, which is always fun, especially around budget time, as we all know, and we've talked about on here
Yes, sir.
a whole lot. So tell people what NFIB is for those people who don't know. I said at the beginning, National Federation of Independent Business, but tell us what all that's about.
Yeah, so we're a national, nonprofit, nonpartisan organization. We represent about 300,000 members nationwide, about 13,000 here in the Commonwealth, all different sectors of the economy, all different corners of the Commonwealth as well. It is our goal to advocate on their behalf, to allow them to grow their business free of intrusive government interference, right? And so we take the message of the small business owner, which is unlike any other story, and we take that to the General Assembly and to Congress, and we advocate on their behalf. We have a presence in all 50 state capitals and in Washington, D.C., and we've had a lot of success in our 83 years in existence.
How do you define a small business?
So I define it a little bit different than the federal government. The federal government's definition is 500 employees or less. 500 employees seems like a rather large
seems like a big company, doesn't
business
it?
To us. And so when we look at small business, we look at our members, and we poll our members, and we take the data from our members, and our average member only has 10 employees.
Okay.
And so oftentimes we're the business on Main Street that has the now hiring sign that was red at one point. It's sun faded now to orange or yellow.
Because you can't find people.
Because we can't find people.
Yeah.
And so those are many of the businesses that we have, the multi-generational shops that have, grandparents, parents, and kids all working in the same business, small business.
Okay. So what is Pennsylvania's climate for small business these days? How is it for your members?
It's rather moderate right now, kind of middle of the road.
Okay.
I think if you look at some of the data points, CNBC says that we're 17th in the nation for operating a business, but Wallet Hub has us 43rd for starting a business. And I think those two things are a little bit in conflict with each other, right? We need to get to a place where the regulatory burdens aren't as great. We have over 166,000 individual regulations on the business community here in the Commonwealth. And so it's a difficult place when you didn't necessarily go to college for business management. You had a passion, a skill, and you wanted to start a business. Well, that death by 1,000 cuts that the General Assembly kind of inflicts on the business community can be rather painful, and it can find small business owners in a place of non-compliance and oftentimes trying to figure out what it is they need to do to remain compliant. And so, we've made good success in the decreasing of the corporate net income tax, and that's great. But 75% of our membership is actually pass-through entities, and so that corporate net income tax reduction doesn't directly affect them. And so workforce participation numbers are often and continuously lower than other states. We have an elderly population here in Pennsylvania, and so many of our businesses are looking for workers, whether they be skilled or unskilled laborers. And so it's a mixed bag, and it can all depend on your locality and the nature of your business on whether or not you're successful or not.
I want to go back momentarily to the tax issue, because you had an op-ed in the local paper here not long ago. But the one thing that I'm curious about is, and we've got about a minute or so before we have to break, is how are you guys doing after COVID? We know how COVID hit small businesses, forcing closures, et cetera. Are they pretty much back, still seeking to get back? I know that a lot of state employees, for example, in Harrisburg, and city employees, Philadelphia, Pittsburgh, aren't back yet. Are they still struggling?
They're still struggling. It's been a slow recovery. They were called non-essential at a time, shut down for a little bit. There's been workforce shortages, inflation, supply chain disruptions. We've seen a lot of that start to, a lot of that pain alleviate. Okay. Right. But I think, certainty is something that is paramount to the small business community. And the tariffs have caused a slight disruption.
We're going to talk about those two here when we come back. And we're going to break here for a few minutes, and we'll come back and talk about a number of other issues. Stay with us.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to Pennsylvania Newsmakers. Our guest here today is Greg Moreland. Greg's the State Director for the National Federation of Independent Business. So a couple things we touched on during the last segment, and one I want to get back to is the income tax issue. Not everyone realizes, well, there's lots of taxes, obviously. Sure. But when we talk about income, it's kind of largely either the corporate net income tax or the personal income tax. As you noted earlier, it's a pass-through. So businesses, because it goes down to them as individuals, pay the 3.07 rate, correct?
Correct.
And you guys are looking for some relief from that or some ways of making small business more
I think we would like
successful.
to get back to the rate that we had prior to 2004 of, under 3%. I think if we're going to look at reducing the corporate net income tax, I think we also need to look at reducing the tax rate on our small businesses and our individuals. It's a very moderate, small decrease in the taxes, but it can make a big impact to our small business community and to our individuals. Anytime you put more money back into the pockets of a business owner, they reinvest back into their business, back into their employees. They hire new folks. They purchase new equipment. And so anytime you're giving a family more dollars, they have more expendable cash that they can go out and take care of what they need to take care of. And so we think it's a good policy that, a rising tide, the ships rise with the tide. And so what's good for one should be good for all.
Okay. All right. The other thing you mentioned, which I do want to get into here, is the tariff situation. A lot of news about that, and I think some of the most feared aspects of that and impacts of that have not yet been felt, and maybe if it doesn't come along, that would be great. But what are your guys seeing? Some of the things that people have said is, well, it hasn't hit yet because we've had inventories that are still being drawn down. What are your guys seeing and feeling as a result of the tariff discussion?
I think that it has created uncertainty amongst our business owners, right? We just had the one big, beautiful bill passed, which got us cemented for our 20% small business tax deduction, which is a great thing, right? And so that's a positive. But the tariffs, on the other hand, have caused uncertainty, and small businesses don't work well in the case of uncertainty. And so oftentimes they don't have the purchase power that large businesses have. They're having to purchase things months ahead of time when that product arrives. Is there a tariff on that country? Has that country come to the table and made a deal? Look, I think our small business owners see the long game. They want business to come back to America. They want manufacturing and big production to come back to America as well. And they see the long game and they're hopeful, but it's that short-term pain that they have to get through. And so, I think that it's a challenging situation for our small business community, but I think many of them, depending on which sector you're in, they're getting through.
Okay. You also mentioned earlier about the whole issue with government regulations, and certainly cutting red tape and reducing the regulatory burden has been a major discussion, even supported by Democrat Governor Shapiro.
Absolutely.
So have you seen positive impacts on that, and I assume you're still hoping for more, even if you have? Yeah,
I think we have seen positive discussions around it. What I don't think we've seen is tangible, real, progress, right? Mm-hmm. And so there have been several bills that have run out of the Senate that we're supportive of, a legislative review of, significant regulations that would cost over $1 million, the ability to repeal regulations through concurrent resolution. These are things that we would support. The bureaucrats in the agencies creating the regulations are largely unaccountable to the public. And the folks that we hold accountable are our elected officials, and those are the folks that we can vote in or we can vote out. And so we need the accountability and the ability to hold those accountable in the elected sphere. And so we would like to see some more regulatory relief, but I think it has been a hot topic for Governor Shapiro and the legislature. Yeah. I think we're moving in the right direction, but as you know, with the budget stalemate and everything, there's just not a lot to hold on to from both sides that everyone can agree to.
Okay. We had a big, and we've got about 30 seconds left, so I have to be quick with this. The major meeting the other week out in Pittsburgh. Mm-hmm. Do your guys see benefits out of the energy boom, which was a big discussion there?
Absolutely. Oh. A 10% increase in energy costs to our members is a huge hit, right? Okay. And so the Regional Greenhouse Gas Initiative and threats like that, the Lightning Plan or whatever Governor Shapiro is calling it now, big threats. We need to drill, baby, drill. We need to use our natural resources that are here, and it's been a great benefit to our members.
Good. Greg, thanks for being on with us. Hope to have you on again.
Thank you.
When we come back, talk a little bit about your access to Pennsylvania's healthcare facilities and are they threatened? And we'll do that when we return.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Welcome back to Pennsylvania Newsmakers. Our next guest is Dr. Lynn Lucas-Fehm. Dr. Fehm is the president of the Pennsylvania Medical Society. So, Dr. Fehm, thanks for being with us here today.
My pleasure.
So, you are a practicing physician. We know that from our previous discussions, and you're down in Bucks County area. So, thank you for joining us today.
Thank you for having me.
Greatly appreciate you coming in. So, last time we talked, there was kind of an imminent or might have just happened situation relative to a very critical situation with some of the hospitals down in that area. And you want to talk a little bit about how, in your view, private equity has influenced some of those closures or caused those closures, you would probably go in and say, correct?
Yes, that's right. Private equity is when a group of investors do what investors do, which is set out to make money. The problem when it comes to healthcare is if there aren't any safeguards around it, some of these investors might choose just to be entirely pro-profit at the disadvantage of or even neglect of patients. And that seems to have happened in particular the one closure that we were discussing before, which was imminent during our last conversation, but now has occurred.
Okay.
And as the closure system fell further and further into debt, those investors were still taking their profits and extracting as much money as possible from that health system while it basically failed and eventually went into bankruptcy and now is closed.
Let's talk about the impacts. So there was impacts obviously on the workers, on the patients. How many what were the numbers in terms of
it was thousands of workers. It wasn't in the hundreds. It was in the thousands of people who were affected by that. And it left Delaware County, let's talk about the patients and the citizens of Delaware County, almost like in an urban healthcare desert where there were no close hospitals for them, and many of the people who live in that county are reliant on public transportation, having to go farther. Now those Crozier patients, the closest hospitals would be Riddle, which is part of the mainline health that's in Media. Then there's Mercy Fitzgerald, also in Delaware County, but not close, and certainly not able to fill in for what Crozier had been to that community for so long. So there's huge impacts on thousands of people.
So this issue of private equity in healthcare, is this a new issue? Have we seen this? Is it a move over from previous nonprofits? How pervasive is it, and how new is this?
Billions of dollars, and it's actually a worldwide type of investment. It's come to light more as more and more hospitals have begun to close. But it's not just hospitals, it's nursing homes, it's individual private practices, but perhaps the largest amount of damage comes when you have a hospital that actually closes and leaves the community devastated. Hahnemann actually was part of the same type of issue when it was also private equity that took the buildings, and that's another practice that they have, is they will actually take the buildings and put them into what's called a REIT, or a real estate investment trust. And then part of the agreement is that the poor health system has to pay a lease on the properties that it previously owned. Those lease payments are often quite high, and they go in as debt, as a mortgage, and that puts those healthcare systems into further debt, and often adds and compounds on their failure. So it's not a new concept, and there's private equity in everything. I think what we are discussing, and there's no problem with businesses. I mean, that is part of our culture, a part of our society. But the problem with healthcare is if the motivation for profit becomes all about being pro-profit, and not at all about being pro-patient, then you can have damage.
And that's the problem. Okay.
That's the problem. We need a balance. We need a balance.
When we come back, we're going to follow up a little bit more on this conversation on private equity and healthcare, and we'll be back here in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania American Water. We keep life flowing across the Keystone State.
Welcome back to Pennsylvania Newsmakers. I'm here with Dr. Lynn Lucas-Fehm, who's president of the Pennsylvania Medical Society. So, Dr. Fehm, we were talking before about some of these closures. Now, let's be clear, not every closure is of a private equity. There are some community hospitals, nonprofits that are closing as well, correct?
That is absolutely true. Nonprofits do it, for-profits do it.
Yeah.
It's a problem that when there is decision-making going on that has to do with using monetary factors, there's going to be closures, and sometimes those closures can hurt patients. So certainly I'm interested in all of them, but private equity has been one area I've focused on this year.
And your view is that injects another level of uncertainty, possibility into the whole situation when you're talking about that side of it, correct?
It does, because if you looked at, I'll use the term a mission statement. The mission statement of a private equity firm would be solely to make money, and that's what they do for their investors. I mean, that is their goal. There's nothing in there about patients at all.
Understand. So last time that we talked, you were talking about legislation that the PA Med Society wanted to see in. That has been introduced, correct?
There's the House Bill 1460 has been introduced. We don't know what its final form will be.
You never know that.
You never know that. But certainly it is there to try and put some guardrails on it. And again, I want to make it clear, I want there to be a balance. I am not anti-business. What I am is pro-patient. And so let's have these business type of transactions occur with some respect for taking care of patients.
Yeah, so you're not looking to ban these operations, because in fact you need that investment in certain places to do this, correct?
That's right, and certainly sometimes they have methods that they may utilize that can introduce more efficiency.
Yeah.
It's just we need to have a safeguard, and we need transparency as well. Some of these transactions occur and we didn't even know they happened until a hospital was in trouble. So we need transparency and some oversight, but certainly not to ban it, just to balance it.
So what are some of the particulars of the legislation? What would it do?
Well, again, I don't know what it's going to look like at the end, but I think one thing that is being considered, I had mentioned about the REITs, or real estate investment trusts, where the property is taken and then they force the hospital to have to pay back exorbitant lease prices. I think that's being looked at. Will it be in the final bill? I'm not sure, but certainly that was very harmful in the Crozier situation and added to their debt. So that would be one thing. The other thing would also be to have some oversight in terms of when a deal is being made, that it has to first be presented to the Attorney General's office so that they can determine whether it is in the best interest of the community that the transaction go forward.
Okay. And now, unfortunately, Pennsylvania, you could argue, has a problem worse than many other states because of our aging population. Pennsylvania is one of the oldest on average states. Of course, as you get older, you need more health care. And it isn't just Crozier. That's the most obvious. And it's not just the elder health care. It's trauma center that they lost in that area, et cetera, correct? But there are a lot of other, as we said, both urban and rural populations that are at risk here.
There is. In fact, another hospital that closed back in January and luckily now has reopened is the Sharon Medical Center, which is in Mercer County, the northwestern part of Pennsylvania. It's between Erie and Pittsburgh in a very rural part of the state, owned by private equity. And in January, due to a similar situation, certainly on a smaller scale because it's a smaller hospital, but was closed. And this is an example actually where the AG's office helped, because that hospital is now on a limited basis reopened. It reopened in March or April. And that was with some type of assistance through the AG's office. Hopefully we'll get more of that to allow that hospital to be sold. And actually was sold to another private equity company.
Oh, it was. That was my next question. I wanted to know how that happened.
But in order to make sure that the transaction was in the best interest of that community, there was some AG involvement to get it done, and that hospital has reopened. So, so it's rural, it's urban, it's all states. In fact, it's actually outside of this country as well. Private equity is large, billions of dollars. What
has been the reaction from those in the private equity field to your legislation?
I personally haven't heard anything, so I can't really speak to that. I would think there would be some level of discomfort, but I would also hope that for most of the good actors within it, and there are good actors in it. I don't want people to think there's only bad actors. That they would be in support of getting the bad actors out, the ones that have hurt communities, and want to be one of the good guys to come in and be able to do the funding, and maybe to be able to be more efficient and potentially more profitable and better for our community. So I hope they'll welcome it.
Yeah, and you made a great point. That is, you're not anti this, and you're saying in many cases they're bringing that investment, they're bringing in many cases that innovation. So those are important things that we need to think about. So Dr. Fehm, greatly appreciate you being on. We look forward to hearing more about this. And again, thanks for being with us here today.
Thank you.
Okay. Thank you for joining us today on Pennsylvania Newsmakers. Look forward to seeing you next week. Thanks very much.